Right now to a developing story. Hundreds of local patients possibly exposed to HIV and hepatitis B and C. Rocky Allen, who's a former employee at Scripps Green Hospital in La Jolla, has been arrested in Colorado. He was fired from Scripps Green, accused of trying to switch syringes and steal drugs. Investigators think that he did the very same thing at a Denver area hospital, potentially exposing thousands of patients there. Scripps has contacted more than 500 patients, offering them free blood tests and screening.
Team 10 wanted to know how Allen could move from hospital to hospital undetected. Team 10 investigator Adam Rakusin is live in the newsroom. And Adam, local patients and hospitals aren't as protected as they think.
No, they're really not, because no state agency licenses or regulates these surgical techs. There is a national organization of this, but in California, it's really up to the hospitals for the hiring and termination policies. Lawmakers have tried to do something about this, but Governor Brown didn't agree. Rocky Allen's time in hospitals may be over, but questions now swirling about how he was able to move from job to job without anyone knowing his background. It turns out, in California, there's no oversight agency. When Allen was let go from Scripps Green Hospital in 2013...
At the time of his termination, we did report to the federal DEA.
But that's as much as they could do.
This is a non-licensed role in a hospital. If this had been someone who had a licensed position at Scripps, such as a nurse or a physician, there is an oversight board that we would have to report that to.
According to the Association of Surgical Technologists, only 9 states have laws setting minimum standards for education and certification of surgical technologists. Only 4 states actually register surgical technologists. The chief of staff at Scripps Green wouldn't mind seeing changes.
Having a licensing board would be a valuable asset to all of us. I think that would make it easier for us.
In 2014, California lawmakers tried to make changes. They overwhelmingly passed a bill that would have established minimum education and certification standards for surgical technologists. But before it could begin, California Governor Jerry Brown vetoed the legislation, leaving health providers in California on their own. And the Association of Surgical Technologists did send me a statement saying that they supported the California bill that Governor Brown vetoed, saying they support regulation and minimum competency standards for surgical technologists in every state, including California. Reporting live in the newsroom, Adam Rakusin, Team 10.
And this chart from the CDC shows disease outbreaks all across the country when a hospital worker switched out drugs. In 2009, 18 people got hepatitis C after a case involving a surgical technician in Colorado. A similar situation in 2012, 45 people infected with hepatitis C. This time, the case involved a radiology technician and spread across 3 states, New Hampshire, Kansas, and Maryland. As soon as there are new developments in this story, we will send an update through our 10 News mobile app. You can download it for free from the App Store.